National Advanced Practice Provider Week is celebrated annually during the fourth week of September. It honors the contributions of physician assistants, nurse practitioners, clinical nurse specialists, and others that provide unique and important roles in healthcare. So joining us now to talk more about this is Heather Levine, a nurse practitioner with Corewell Health. Thanks for being here.
Absolutely. Thanks for having me.
So when people think about healthcare, doctors are usually the first profession that comes to mind, but there are so many other people, and that's why we're recognizing this in the fourth week of September. Tell us about it.
Yeah, so what we are is we call ourselves APPs, which is Advanced Practice Providers. There's a lot of people say different words, but that's what Corewell Health uses as Advanced Practice Providers. So what we represent is a group of professionals who have high-level licensure, have gone to school for a longer period of time, and really what the society knows us, or as public knows us for, is being nurse practitioners, physician assistant, and nurse midwives. So that's what an APP is.
Why did you decide to become a nurse practitioner?
That's a great question. So I actually was in nursing school, and then I had a professor who was a physician. He was actually the head of infectious disease at a big university in Chicago. And his wife is a nurse practitioner, and he said to me, I see something in you that I think that this is something that you should be, and just would encourage you to move forward in your education.
So how are you planning to celebrate next week?
So we are having an event where we call it the APSEs. It's kind of like any other Academy Awards, so to say. So we gather together, all of us APPs, and we celebrate just the work that we've done. People get awards for things that they've done in terms of inpatient specialty award, outpatient pediatrics, team groups, physician support, things like that. So we award all those people. It's a really special night that we all celebrate together.
I know that healthcare has really been hit by the pandemic as far as the workforce. Are you seeing that more young people are looking into becoming an APP?
Yeah, I really think so. So part of it is that there's a shortage, right? There's a shortage in physicians nationwide, and that's really impacted all of us as patients and those of us that work in healthcare as well. So APPs are really the people that get to fill the gap there and really bridge the gap for patients who don't have access to a physician necessarily. We still collaborate with a physician, absolutely, but again, we are able to access that patient a lot sooner in a visit than unfortunately the physicians can, just due to that shortage.
Do you still find that people, you go into the room and they see that it's the APP and not the doc, and what are the reactions, and how do you teach them that you're just as qualified and are able to service them faster?
So typically what I do is I make sure that the patient knows that I understand their medical history. Being a patient, I know that's super important to me too. I understand where you're at. I've spoken with your physician. We collaborated together as a team. And that might be with a physical therapist, that might be with a dietitian, that might be with several other members of the team as well. So I make sure that they know that, I am a professional and of course have had the education appropriate for this role, but then additionally have worked with other members of the team to really understand and wrap around that patient to provide the care that they're really hoping to get that day.
Yeah. Heather Levine from Corewell Health, thank you so much for joining us.
Thanks so much for having me.